Upper respiratory infections, or URIs, refer to infections that affect the upper part of the respiratory tract, which includes the nose, sinuses, pharynx, and larynx. These infections are common and are often caused by viruses, though bacteria can also be responsible in some cases. Common types of upper respiratory infections include 1. The common cold, usually caused by rhinoviruses, coronaviruses, or other viruses. 2. Sinusitis, which is inflammation or infection of the sinuses. 3. Pharyngitis, inflammation of the throat, often caused by viruses or streptococcus bacteria. 4. Laryngitis, inflammation of the larynx, often resulting in hoarseness. 5. Tonsillitis, infection of the tonsils. 6. Epiglottitis, a rare but serious inflammation of the epiglottis, usually bacterial. Symptoms of URIs can vary. Mild symptoms, such as those seen with the common cold, include runny or stuffy nose, sneezing, sore throat, cough, low-grade fever, fatigue, and mild headache or body aches. More severe symptoms, such as those seen with bacterial sinusitis or epiglottitis, include high fever, facial pain or pressure, difficulty breathing, hoarseness, and difficulty swallowing, especially in epiglottitis. Upper respiratory infections, or URIs, are most commonly caused by viruses. These include rhinovirus, coronavirus, influenza virus, parainfluenza virus, and respiratory syncytial virus, also known as RSV. Bacterial causes, though less common, include Streptococcus pneumoniae, Haemophilus influenzae, and Group A Streptococcus, often referred to as gas. Treatment for URIs really depends on the cause. For viral infections, symptomatic relief is recommended. This means getting plenty of rest, staying hydrated, and using over-the-counter medications like decongestants or antipyretics. It's important to avoid antibiotics unless there's a secondary bacterial infection. For bacterial infections, antibiotics may be prescribed, such as amoxicillin for bacterial sinusitis or strep throat. Supportive measures can also help, like warm saltwater gargles for a sore throat, steam inhalation, or humidifiers for nasal congestion, and avoiding irritants like smoking. You should see a doctor if your symptoms last longer than 10 days or worsen after initial improvement. Also, seek medical advice if a high fever above 102 degrees Fahrenheit or 39 degrees Celsius persists, if you experience severe facial pain, swelling, or difficulty breathing or swallowing, or if hoarseness or a sore throat lasts more than a week. Would you like specific advice on managing symptoms or any particular aspect of upper respiratory infections?